हेलो एवरीवन, मेरा नाम अश्मिता है और आज की इस वीडियो में हम सॉल्व कर रहे हैं मल्टीपल चॉइस क्वेश्चंस फ्रॉम द रेस्पिरेटरी प्रॉब्लम्स। नर्सिंग के क्वेश्चन पेपर है एग्जाम एंट्रेंस एग्जाम के। तो चलिए स्टार्ट करते हैं। पेरेंट्स ऑफ अ 5-week old have just been told that their child has cystic fibrosis, that's CF. The mother had a sister who died of CF when she was just 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy. What is the nurse's best response? First बताया जा रहा है कि जो life expectancy है for cystic fibrosis patients has improved significantly in the recent years. तो parents जो है they are devastated by the new diagnosis obviously and are likely not ready to hear about the current life expectancy for the CF patients. So they are in shock and they are trying to deal with the new diagnosis, so any additional information will just add to their stress level. Okay, तो ये तो गलत हो गया. Next, your child might not follow the same course that the mother's sister did. तो the mother had a negative experience with cystic fibrosis, right, in her own family, and will likely continue to focus on her past experience only with the disease. So, it may be more effective to give her time to consider her child's diagnosis and present her with information about the current treatments with life and also about the lifespan in a few days. So, ये भी गलत है, ये बेस्ट रिस्पॉन्स में से नहीं हो रहा है. ये गलत नहीं है लेकिन बेस्ट रिस्पॉन्स में से नहीं हो रहा है. आते हैं नेक्स्ट पॉइंट पे. The healthcare provider will come to speak to you about treatment options. So, having the healthcare provider return with additional information will not help these parents at this time. So, they need time before they are given additional information. तो ये उतना भी ज़्यादा अच्छा रिस्पॉन्स नहीं है. Last, the nurse answers their questions briefly, listens to their concerns, and is available later after they have processed the information. तो nurse का जो best intervention है that is to listen as the parents express their concerns and fears. So the nurse's answers should be brief, knowing that the parents are not able to process the information right now. The nurse should be available later if the parents have any other concerns or questions, or if they just need someone with whom to talk. So yes, you can go with this one. Last, a 7-month-old has a low grade fever, nasal congestion, and a mild cough. What should the nursing care management of this child include? Select all that may apply. So यहाँ पे आप एक से ज़्यादा भी options select कर सकते हैं. नेक्स्ट सो यहाँ पे जो पांचों ऑप्शंस दिए गए हैं, चलिए देखते हैं कौन से ऑप्शन सही होंगे. मेंटेनिंग स्ट्रिक्ट बेड रेस्ट, अवॉइडिंग कॉन्टैक्ट विद फैमिली मेंबर्स, instilling saline nose drops and bulb suctioning, keeping the head of the bed flat, providing humidity, and propping the head of the bed up. तो यहाँ पे जो फर्स्ट चीज़ है दैट इज स्ट्रिक्ट बेड रेस्ट, इट इज़ नॉट नेसेसरी. Children with respiratory illnesses usually self limit their activity. So, parents just need to ensure that their children are getting adequate rest. So, ये उतना ज़्यादा अच्छा नहीं जा रहा है. Okay, second one, avoiding contact with the family members. So it is not necessary to avoid contact with the family members. Nasopharyngitis is spread by contact with the secretions. So hand washing is the key, of course, to limiting the spread of the virus. तो ये भी यहाँ पे नहीं जा रहा है. Third one, instilling saline nose drops and bulb suctioning. Infants जो है ना, infants are nose breathers and they often have increased difficulty when they are congested. So, nasal saline drops and gentle suctioning with a bulb syringe are often recommended. So, ये आप select कर सकते हैं. Next, keeping the head of the bed flat. Head of the bed should be elevated in order to help with the drainage of the secretions. तो ये तो नहीं जाएगा. providing humidity and propping the head of the bed up. Other helpful suggestions for infants with colds are to provide humidity with a cool mist humidifier or take them into a steamy bathroom. So, in addition, we can say raising the head of the bed will help with the drainage of the secretions. तो हम इस पॉइंट को कंसिडर कर सकते हैं 3 and 5. Next question. A school age child has been diagnosed with nasopharyngitis. The parent is concerned because the child has had little or no appetite for the last 24 hours, which is the nurse's best response. So यहाँ पे बताया गया है कि नर्स का सबसे बेस्ट रिस्पॉन्स कौन से हैं. So do not be concerned. It is common for children to have a decreased appetite during a respiratory illness. Second, be sure your child is taking an adequate amount of fluids. The appetite should return soon. तो ये जो सेकंड पॉइंट है दैट बी श्योर योर चाइल्ड इज टेकिंग एन एडिक्वेट अमाउंट ऑफ फ्लूइड्स तो द एपेटाइट शुड रिटर्न सून. Now, over here, it is common for children to have a decreased appetite when they have a respiratory illness. So, the nurse is appropriately like instructing the parent that the child will be fine by taking in an adequate amount of fluid, which will keep the child hydrated. तो ये आप कंसिडर कर सकते हैं एज द बेस्ट रिस्पॉन्स टिल नाउ. नेक्स्ट चलिए कंसिडर करते हैं नेक्स्ट पॉइंट को. ट्राई ऑफरिंग द चाइल्ड सम फेवरेट फूड, मे बी दैट विल इम्प्रूव द एपेटाइट. देखिए द चाइल्ड मे वॉन्ट टू ईट सम फेवरेट फूड बट द चाइल्ड हाउएवर द चाइल्ड विल बी फाइन इफ एन एडिक्वेट अमाउंट ऑफ फ्लूइड इज मेंटेन्ड. ओके, तो उतना ज़्यादा अच्छा रिस्पॉन्स तो नहीं है. Last point, you need to force your child to eat whatever you can. Adequate nutrition is essential. The parent should not force the child to eat. The child's appetite should return in a couple of days. तो ये forcibly कुछ करना child को नहीं लगेगा ऐसा कुछ. तो हमारे जो करेक्ट आंसर है वो नंबर 2 है. तो आज के वीडियो के लिए बस इतना ही. अगर आपको ऐसे डिस्कशंस करने हैं, क्वेश्चन पेपर सॉल्व करने हैं, इंटरैक्टिव सेशंस चाहिए तो आप हमारे क्लासेस में ज्वाइन कर सकते हैं. उसके लिए आपको नीचे दिए गए डिस्क्रिप्शन बॉक्स में जाना है और हमारे जो कॉन्टैक्ट डिटेल्स है उस नंबर पे कांटेक्ट करना है. एंड जो वेबसाइट लिंक है उसको आपको जस्ट जाके चेक करना है फॉर नोइंग मोर डिटेल्स अबाउट आवर क्लासेस. कोई भी एंट्रेंस एग्ज़ाम्स हो, कोई भी गवर्नमेंट जॉब के एग्ज़ाम के प्रिपरेशन कर रहे हो, उसके लिए हम आपको हेल्प करेंगे. लाइव लेक्चर्स, रिकॉर्डेड लेक्चर्स, पोर्टल एक्सेस, लाइक डाउट क्लियरिंग सेशंस, देन study materials, then this mock test facilities, solving the previous year's question papers, practicing them. We will help you out with everything. So thank you for being with me till the end. चलिए मिलते हैं अगले वीडियोस में.